thoracolumbar side bending. There's two methods you can do for thoracolumbar side bending. You can, same thing, use the measurement where you're going to measure. Do we do knee joint and ground or just?
I would do just ground because they go past. I guess you could still do it, but that could.
Yeah. Okay, so for side bending, same thing. You're going to use the middle tip of your middle finger. You want to be consistent with what you're measuring and how you're measuring. You're going to have the patient side bend, and you're going to again allow that lateral translation in that transverse plane, but you don't want that pelvic tilt, that pelvic elevation, hip height. And then you're just going to measure from the middle finger to the floor. And again, there is not a normative for this because height.
Do we do like a pre-measure or no? Like to find the baseline or standing?
Well, standing is just, their baseline would be when you first evaluate them, you see how much side bending they have, you take that measurement. What you want to be consistent with is if you do fingertips to floor on day one when you're evaluating them, when you go back for your progress note and do a retest, you need to use the same method versus I'll show you the Goni method in just a second.
I see. So she's asking so we're not doing the same thing we're doing with the flexion and extension,
right,
where you're measuring the difference.
Right.
You're just measuring the.
Okay.
Yeah.
You
So you're
could
not
do
going to
that
stand
if
here
you
and
wanted
measure that.
Okay.
No one's ever asked that before.
No.
That makes sense.
Sorry. Okay. So same thing. Stabilizing, I like to keep my fingers on PSIS for visual cue, and this one especially will help if you can see your thumbs kind of going higher, one going higher than the other. I'm gonna have my patient stand nice and tall. I'm gonna have you keeping your fingers at your side. Can you slide your right hand down towards the ground, finger outstretched as far as you can. Go, 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 and stop. Any pain there? Okay, hand off, overpressure, firm and feel. Any pain?
No, just
And to me that looks like it's about 40 centimeters. Sorry, my hands are freezing cold.
kind of feels good.
It's an ice pack. All right. Good thing. And same. Can you reach down to the ground? Stop. Any pain?
No.
Okay. Fingers out. So she's at 38 point. She was at 38.7 and I dropped it. I think I estimated 40, so I was close that time. Okay.